And lastly, the fifth layer that you know is the periosteum covering the cranial wall from outside, that we also call as pericranium. इससे रिलेवेंट जो क्लिनिकल पॉइंट है वो ये कि इन केसेस ऑफ फ्रैक्चर और अ ब्रीच इन द कंटिन्यूटी ऑफ अ बोन मे बी बिकॉज ऑफ ट्रॉमा, so there will be bleeding, and that blood from the cranial vault will settle down below to the pericranium and will spread out overlying to that particular bone, taking the shape of that flat bone. Because remember, there are sutures surrounding to each of these bone of the cranial vault, like in case of parietal bone fracture, so the blood will deposit below to the pericranium or the periosteum covering the parietal bone, but it will not be spreading out under to the pericranium of other bones or the adjacent bones. The reason is these sutures, they have an intersutural ligaments which restrict the spread of hematoma from one bone to the other bone. So in short, you can remember that the hematoma deposited below to the periosteum is called cephalhematoma. Now this cephalhematoma has a peculiarity that it will not cross the sutural ligament, so this will spread over to a particular bone. Another thing is this swelling, if you press, this will be tense and will be painful. Unlike the other two swellings which I told you before, that was subgaleal hematoma and caput succedaneum.